It's, as you understand, a very important topic that we are discussing this morning. My name is Chris Fern. I'm the Deputy Prime Minister and Minister for Health from Malta, and I'm one of the members of the Global Leaders Group for Antimicrobial Resistance. As you know, I'm also a pediatric surgeon, by the way, but you don't need to be a surgeon to understand the importance of antibiotics, because antibiotics, over the last 100 years or so, have saved millions upon millions of lives. Unfortunately, the very success of antibiotics is endangering their use by the emergence of organisms, mostly bacteria, that are resistant to a large number of antibiotics. And by conservative estimates, last year alone, close to 2 million people died because of infections which we couldn't treat because we did not have the antibiotics to treat them. And this problem is only going to get bigger, which is why 4 international organizations, Food and Agriculture Organization, the World Organization for Animal Health, the World Health Organization, and the United Nations Environmental Programme created the Global Leaders Group for Antimicrobial Resistance, which is a group of experts and movers from around the world. I have the honor of being one of the members of the Global Leader Group, and which is why today we are organizing the side event on antimicrobial resistance. We need you to advocate, to put this important topic of global importance on the national and international agendas. So today's meeting is an advocacy meeting. So please tweet, use hashtag of AMR or CHOGM 2022 or at GLG AMR on your tweets and on your social media so we can spread the message as widely as possible. And please do ask your media back home to report on this event and on future initiatives on AMR. Today's meeting will have two parts. In the first part, we are honored to have a number of eminent leaders from around the Commonwealth and Dr. Tedros from WHO, who will be taking the floor on the podium for a few minutes each to give us their esteemed views on AMR. And then we have a panel of experts who will also be asked to comment on this topic. And then hopefully in about 50 minutes time, we will be able to wrap up. So without further ado, I will ask first, I have to say before we go that we were expecting also Her Excellency, the Prime Minister of Barbados, Mia Motley, to be here today, but unfortunately she tested positive before coming over, so we wish her well. And Her Excellency Motley, together with the Prime Minister of Bangladesh, are the leaders of the Global Leaders Group, so we're thanking them for the efforts that they do. But to kick off, we will now ask His Excellency the Prime Minister of Bahamas, Philip Davis, to take the podium and give us his comments this morning. Thank you very much, Your Excellency.
Morning, and thank you very much for allowing this very brief intervention of mine. It is important that we sensitize and make our people aware, particularly leaders, of the challenges that we have in the healthcare system. There are many dangers out there to our health, and most of those dangers are manufactured by conduct of human activity. And so, as we embark upon raising awareness to this issue of the I call it the AMR, it is important that we pay attention to it. I've stopped by to be here to indicate our commitment to ensuring that our voice is heard in respect to this aspect of the challenges to our health, because for me, I believe in the old adage, the health of the nation is the wealth of the nation. Thank you.
Thank you very much, Your Excellency. Thank you for your support and for the support of the Bahamas in this global effort that we have against AMR. As you all know, now 7 years ago, 2015, there was a commitment by all member states of the UN to start producing national action plans on AMR. A lot of countries have that. Some of us now are in the process of renewing our national action plans, but we need to act on them, which is why today our topic is delivering on collective political action on AMR. So thank you once more, Prime Minister Davis. I now ask His Excellency Dr. Jerome Walcott, Minister of Foreign Affairs for Barbados, who will be speaking as well on behalf of GLG Co-Chair, Her Excellency Mia Moore, Prime Minister of Barbados. Foreign Minister, the floor is yours.
Good morning and thank you. Thank you. Good morning to all. His Excellency, Prime Minister of Bahamas, Minister Moman, colleague, Dr. Tedros, dear ministers, senior officials, development partners, distinguished participants and friends. As the chairman said, Prime Minister regrettably is not here, and I'm going to be merely reading her remarks, her comments to you. First of all, she wanted to extend condolences to Her Excellency Prime Minister Sheikh Hasina and the government and people of Bangladesh on the loss of life and property as a result of the flooding in Bangladesh. She says we shall keep all those families who have experienced grief as a result of this severe weather event in our prayers. She went on to say to our host, the government of Rwanda, thank you for accepting to host this event. I appreciate all the support that people across your different ministries have provided as we prepared for it. Special thanks to you, Excellent Christopher, Deputy Prime Minister, Minister of Health of Malta, for his leadership on the event on behalf of the Global Leaders Group on AMR. I thank all of you for taking time to be here with us today. AMR is not a compelling acronym, but antimicrobial resistance is an issue that should compel us all. Our most precious medicines are at stake. Global food production is at stake. Our plants and the environment are at stake. Human livelihoods and our economies, all of these are at stake. These are the stakes if we lose the antibiotics and other antimicrobials that we too often take for granted. Already 5 million deaths a year are associated with AMR, and this will only get worse if we do not all treat AMR as a looming crisis, the silent pandemic that it is. I agree to co-chair the Global Leaders Group on AMR because it is not enough that the UN General Assembly, the WHO scientists, veterinarians, and many others have been sounding the alarm on this issue for several years. We need political action. Antimicrobial resistance is not a technical matter, it is political. And we need political leadership on this issue in every country. Every country needs a funded national plan to address AMR, laying out the practical steps it will take across sectors to prevent AMR and mitigate its impact. Every country needs to treat this as a health, economic, and development priority. We need to promote the issue of AMR in the international fora, such as this, and support those working on it in the multilateral system. We need to engage the private sector. We need to engage young people in the same way that they're engaged in the climate crisis, because it is their future at stake. And we need a response that is adequately financed, including by those who profit from this problem. So I thank you. Please act. Please engage in this issue, and in so doing, help to create a healthier, safer, more equitable and prosperous world. Thank you.
Thank you so much, Minister Walcott, and please do convey our thanks and best wishes to Prime Minister Motley. And now I would like to ask the Foreign Minister of Bangladesh, His Excellency Dr. Abdul Momen, who will also be speaking on behalf of the other GLG co-chair, Her Excellency Sheikh Hasina, Prime Minister of Bangladesh. Foreign Minister, the podium is yours.
Thank you. Honorable Prime Minister of Barbados, Honorable Deputy Prime Minister of Malta, Global Leaders Group, Excellencies, ladies and gentlemen, Assalamu alaikum, peace be upon you all. I am honored to join you at this breakfast meeting on the global crisis of AMR. We are grateful to the Honorable Prime Ministers of Bangladesh and Barbados for their leadership in calling stronger global actions to avert the deadly consequences of AMR and increasing mass awareness about it. My Prime Minister Sheikh Hasina would love to be here, but since the budget session is on, she has to stay home to face the music. I wish her good luck. This global health threat risks our decades of development and achievement in the healthcare system. Misuse and overuse of existing antimicrobial in humans, animals, and plants are accelerating the development and the prevalence of AMR. Our efforts to provide access to clean water, sanitation, and hygiene, as well as ensuring good health and well-being for all, connect directly AMR with sustainable development goals. Consequently, addressing AMR should be integrated with the SDG implementation in a concerted manner. 2 years into the COVID-19 pandemic, our world is still having a profound impact on lives and livelihoods. Moreover, the climate change impacts have put extra burden on disease control. In such context, if we cannot control the responsible use of the antibiotics, we may see more deadly pandemics in future. Excellencies, Bangladesh has prepared a national strategic plan and national action plan on antimicrobial resistance containment for 6 years, 2017 to 2022. In 2017, our leading physicians, veterinarians, scientists came together to form the Bangladesh AMR Response Alliance for rational use of antibiotics. We are conducting regular laboratory-based AMR surveillance for both human and animal health to ensure WHO categorization. Moreover, we have been providing comprehensive AMR surveillance data to WHO GLASS platform. To prevent the uncontrolled use of antimicrobials, we must break institutional silos and work transversally across governments, international organizations, agencies, civil society, and the private sectors, manifesting whole of the society approach. In addition, we must understand that the increased healthcare expenditure due to AMR will have a cascading effect on food system, education, livelihoods, and ultimately will enhance risks of poverty and inequality. As such, the economic cost of AMR needs to be highlighted to recalibrate our health policies and national priorities. We must remain alert on selling of antibiotics without prescription and non-regulated marketing of the antimicrobials. A comprehensive laboratory-based surveillance system needs to be established and set up among the human fisheries and animals. We should establish advocacy communication and social mobilization to regulate the unnecessary use of antimicrobials. Adequate resources are needed for antimicrobials related research. We should remain focused on technology transfer in the developing countries and equitable access to innovations for better results. Excellencies, finally, we have already learned that no one is safe until everyone is safe when it comes to risks to human health. Since AMR has emerged as another substantial threat before humanity, we need committed, cohesive, coherent actions for accelerated response to secure our common future from drug-resistant diseases. I thank you all.
Thank you so much, Minister Moman, and please do convey our regards and thanks to Prime Minister Hashina. We know it is a difficult time also for your people. And you are right, of course, that AMR is not a question only of health ministers or the health sector, but it is a question of the whole of society approach, and the solution has to be a whole of society. With that, I would now ask His Excellency Mr. Alan Ganu, who is the Foreign Minister of Mauritius, to give us his thoughts also on this important subject this morning. Thank you, Foreign Minister.
Thank you, MC, Vice President of the Republic of Malta. Honorable Prime Ministers, colleague ministers, senior distinguished representatives of the WHO, senior officials, ladies and gentlemen, all protocol observed. I bring with me, firstly, the greetings of my Prime Minister, who has unfortunately not been able to make it today because he just landed a few minutes ago at the airport, and he insisted that I should be present here to pay my tribute firstly, to pay our tribute firstly to the two distinguished leaders, the Prime Minister of Bangladesh and the President of Barbados, for these laudable initiatives that they have taken. I am personally honored to be with you this morning, and I thank the organizers for this special session. Ladies and gentlemen, Mauritius recognizes that AMR is a growing threat to global public health that transcends national boundaries and socio-economic divisions. We are fully alive to the fact that AMR is a multi-faceted problem of crisis proportions with significant economic, health, and human implications. AMR threatens the effective prevention and treatment of an increasing range of infections, as we know, caused by bacteria, parasites, viruses, and fungi. The situation in Mauritius regarding AMR is worrying. But I must tell you, before I go in more details, that in Mauritius we have a very dynamic, strong, and vibrant welfare state. Health services are free, education is free from primary to tertiary level, transport is free, public transport is free to education, to students and senior citizens. Every Mauritian is entitled to a non-contributory pension at the age of 60, old age pension we call it in our country. But despite that, I was going to say that our health standard is fairly good generally, but in spite of that, with regard to AMR, as I just told you, the situation has been worrying us. Based on a situation analysis that was conducted in 2019 to 2020, Mauritius has been found to be one of the highest prevalence of multi-drug resistance organism, the MDRO, in its ICUs in the world. It is estimated that roughly 1 person dies every day from an MDRO in Mauritius, and that this directly and indirectly cost our country about 600 million Mauritian rupees which is about 20 million USD. Outbreaks of the highly AMR concerning carbapenem and colistin-resistant, Klebsiella pneumoniae and of vancomycin-resistant have been occurring frequently in the last few years in our island. Only 18% of antibiotics are prescribed on the correct dose. On the correct dose, frequency, duration, and type for an inpatient. Only 47% of antibiotics are prescribed for the correct indication in admitted patients. This suggests that antibiotic abuse remains prevalent in the country. But we have taken the following actions. A national action plan was developed on the MDRO in 2017, and this action plan will be updated in 2022. Data on antimicrobial use was gathered in several hospitals and in dispensaries in 2018-2019. A situational analysis on MDRO and on antimicrobial stewardship was conducted in 2019-2020. Routine surveillance on MDRO has started in September 2021 in the ICUs of the country. Our island, Rodrigues, which is an offland island, is due to start its surveillance in 2022. The National IPC, Infection Prevention and Control Guideline, was finalized and approved in December 2021. It discusses MDRO in several of its chapters. Outbreaks notifications are being sent to hospitals regularly, and simple outbreak investigations are being carried out as from January of this year. The bundle of care for the prevention of MDRO is being reinforced by the regional IPC teams. CMEs on MDRO are being carried out since March of this year. The National Action Plan on IPC contains several activities related to MDRO and was approved as of April 2022. This is a testimony that we are aware of the dangerous situation in which we are living, and this is why these following measures have been taken. To conclude, Chair, we fully support the GLC in its efforts to scale up international action and coordination in promoting appropriate antibiotic use. We will work further together to reduce AMR using the One Health approach, which recognizes that human, animal, and environmental health is inextricably linked with our overall goal of reducing the spread of resistance. I have done. Thank you for your attention.
Thank you so much, Minister Genu, and you are right, of course, that even though there is a need for international cooperation and collaboration, because this is a global problem, but a lot of the solution is local and is down to detail. So correct prescribing, for instance, is a very important aspect to this. Now, before I call on the next speaker, I would like to ask you for a round of applause for the government and the people of Rwanda for organizing such an important and excellent meeting, Commonwealth meeting as CHOGM today, and thank you very much for co-hosting this event together with us. And now I will ask you also for another round of applause if I manage to get your name right, because if I pronounce your name right, I need a round of applause. Because now I would like to ask the Minister for State from the Ministry of Health for Rwanda, Dr. Taichis Mpunga. Did I get that right, you see? And I will ask you for your comments. Thank you so much for being with us this morning.
Excellencies, Prime Ministers, distinguished delegates, I am pleased to join you today for the CHOGM side event at delivery of collective political action to address antimicrobial resistance. Antimicrobials have been used to save lives of human, animals, and plants. However, their misuse gives the ability to microorganisms to fight antimicrobials so that they are no longer effective. It has resulted in a situation where conventional therapies become ineffective, and infectious continue to create a risk of contamination and the spread within human and animals. Antimicrobials resistance undermines the successful prevention and the treatment of increasing variety of bacteria, viral, fungal infections that have a significant impact on public health, food security, economic and livelihood of people, animals, and environment. The impact of this phenomenon of public health have led to a range of attempts on national, regional, and global level to combat and contain AMR. And the Global Leaders Group on AMR organizing this event is a part of the same framework. A recent study estimated that in 2019, AMR-related deaths were almost 5 million, most of which are in lower and middle income countries, where the infectious disease is large. Apart from death, AMR is associated with a long hospital stay, use of second and third line of antibiotics, which are very expensive for poor individuals. Excellencies, distinguished delegates, the concept of One Health was introduced to express the idea that human and animals' health are interdependent and related to the health of our ecosystem. Inclusive and connected solutions are very urgently needed and advocated by the Global Health Action Plan by WHO and FAO. Based on the model recommended in this Global Action Plan and the guidelines, Rwanda has developed a national action plan on antimicrobial resistance. It is a tool representing the consensus of stakeholders on evidence-based to introduce through a multi-stakeholders platform of shared experience over a 5-year span of frequency review during the implementation process. We have called upon the commitment and the engagement of our stakeholders and partners to put together resources that will allow the full implementation of this national action plan on AMR in such a way that human and animals' lives in an environment free of antimicrobial resistance. Rwanda commits to enhancing the collaboration with different sectors, especially stakeholders and partners, to work together to solve the issue of antimicrobial resistance. Therefore, I take this opportunity to express my gratitude for the commitment of this forum to tackle the issue of AMR and encourage everyone present here to advocate for further and mobilization of effort toward the growing the plague of AMR. I thank you for your kind attention.
Thank you, State Minister Mpunga, and once more, thank you to Rwanda for the excellent organization of the Commonwealth CHOGM meeting. Thank you once more. So now I would like to ask Director General, WHO, Dr. Tedros Ghebreyesus, you've led us these last 2.5 years during the COVID pandemic. We need your continued leadership now for this the silent pandemic, which is AMR. Director General, thank you so much for being here.
Thank you, Your Excellency. Your Excellency, Prime Minister Philip Davis of Bahamas, and Your Excellency, Deputy Prime Minister and our moderator of Malta, Excellency Jerome Malcott of Barbados, Your Excellency Foreign Minister Momen of Bangladesh, Excellency Alan Ganu of Mauritius, and His Excellency State Minister Tachis Mpunga of Rwanda, Excellencies, dear colleagues and friends. Thank you to the governments of Rwanda and Malta for bringing us together to discuss the pressing challenges of antimicrobial resistance. Murakoze Chane. And thank you to their excellencies, Prime Minister Maya Motley of Barbados, and Prime Minister Sheikh Hasina of Bangladesh for their steadfast leadership as co-chairs of the Global Leaders Group on Antimicrobial Resistance. In our modern industrialized world, a fundamental truth has too often been pushed aside, that the health of humans, animals, and our environment are intimately connected. The growing threat of AMR threatens to send us back to the time before antibiotics, when even a routine injury could kill. Already, AMR is estimated to lead to 5 million deaths every year. This is why we can only truly address the major health challenges of our time with a One Health approach. And as COVID-19 has demonstrated, shared global threats require a shared response. AMR has impacts for every sector, and every sector must be engaged in the response. The public and private sectors across health, agriculture, and environment. Together, we must change practices to protect the antimicrobials we have. We must invest in surveillance to have a true picture of the evolution of antimicrobial resistance around the world. We must invest in research and development for new antibiotics. And we must find better approaches to waste management. For years, WHO has worked closely with the UN Food and Agriculture Organization and the World Organization for Animal Health as part of the One Health tripartite. Earlier this year, we officially became a quadripartite with the welcome addition of the UN Environment Programme. Recently, our 4 organizations published a strategic framework for collaboration on antimicrobial resistance, outlining our goals in the coming years. On behalf of the quadripartite, I reiterate our shared commitment to support national One Health response to antimicrobial resistance, which need to be underpinned by policy and technical frameworks and sufficient institutional capacity and resources. As the world begins to recover from COVID-19, we must remember that many of the measures needed to prevent and mitigate future pandemics are also needed to address antimicrobial resistance. This includes stronger surveillance, better water, sanitation and hygiene in medical facilities, enhanced infection prevention and control, and strengthened systems for human and animal health. Thank you all for your commitment to addressing this urgent global health challenge. I look forward to working with Commonwealth countries in our shared fight against antimicrobial resistance, and I thank you. And I would like to finally thank also His Excellency, the Deputy Prime Minister, for taking over in the absence of our 2 co-chairs, and thank you so much for your able leadership, Your Excellency. Thank you.
Thank you. Thank you very much, Dr. Tedros. Your presence here underlines the importance that your organization, WHO, and the UN gives to antimicrobial resistance. And I have to say, you have a very active and very able secretariat led by Dr. Haley here, who has not just over these last few weeks to organize this event, but over the last year and a half, been working tirelessly to make the Global Leaders Group a success. Thank you very much for your leadership there as well. So this brings us to the conclusion of the first part of this meeting. We're running just a little bit late, but not too late. And I thank all of the speakers, the eminent speakers from the first session of this meeting. We're now lucky to have amongst us some world leaders and experts on AMR who are forming part of our panel. And I will ask everyone to be briefish, so we might have a few minutes at the end for 1 or 2 interventions from the floor. To kick off, I would like to ask His Excellency Dr. Asagi Nhire, who is the Minister for Health for Nigeria, to give us some comments. And specifically, Minister, I would like to ask you, being a Minister for Health, if you had to identify two specific critical challenges that we are facing in our fight against AMR, what would these two challenges be? Minister.
Thank you for the opportunity, and good morning to everybody. I would like to rest on the protocols so well established by Dr. Tedros. I recognize the Prime Ministers, all the ministers here present, and the organizers. Nigeria will align itself with the comments made so far on the threat that AMR means to global health, and will dwell only on the challenges that we have faced. The first is uncontrolled, unregulated access to antibiotics in our countries. So a lot has been said on that so far. And the second is the lack of awareness of the consequences of such abuse. Nigeria has a national action plan established in 2017, and under the One Health approach, merges the efforts of human, animal, and environmental health experts to create an integrated response, to improve regulation, to strengthen the regulatory organ, National Agency of Food and Drug Administration in Nigeria, to restrict the reckless use of antibiotics. With regard to creation of awareness, we need to strengthen health promotion and also improve social behavior and communication, social behavior change, and better communication with the users. Surprisingly, a large number of young professionals are not aware of the risks and hazard of the abuse and misuse of antibiotics. With those ones who believe that we can have a better handle on addressing the menace of AMR in Nigeria.
Thank you so much. Thank you so much, Minister. For the sake of expediency, I'm going to ask the other speakers to address us from the table so that we can get as many people in as possible. So I would now like to ask Professor Borch, who is the chair of the National Antibiotic Committee in Malta and the leading worldwide authority on AMR. And Professor Borch, maybe you can explain when it comes to human health, because of course AMR is not just on human health, as we've heard already, but how would you see that professional healthcare workers contributing to the fight of AMR even on a local level? Professor Borch.
Thank you. Well, thank you. Is this working?
Yes.
Okay. Well, thank you, Your Excellency. Yes, undoubtedly, healthcare professionals, as well as their associations, are key stakeholders in our efforts to address AMR. I mean, undoubtedly, they are the ones who are probably most effective in convincing both clinical colleagues as well as patients and the general public about the real threat that AMR poses, as well as the need to take action. They're also the ones who have to buy in, participate, and in some cases even spearhead interventions to improve what we've heard about already, antibiotic stewardship, as well as infection prevention and control practices, especially within hospitals. And they can be quite effective at this and quite successful. I can maybe share our experience in Malta, where the efforts of numerous healthcare professionals managed to obtain an 80% reduction in life-threatening bloodstream infections caused by methicillin-resistant Staphylococcus aureus, or MRSA. But however, if I can take one take-home from our experience in this success story, it is that we would probably have never achieved this level of reduction if we did not have the effective support of our policy and decision makers. And I think this is the key about AMR. AMR is a highly complex phenomenon. It is driven by numerous behavioral drivers and enablers. In fact, I very often compare it to climate change. It is as complex as climate change. And just like in climate change, we cannot rely solely on a bottom-up approach by healthcare professionals. Yes, the healthcare professionals are essential. They are at the cutting edge. But as we've heard already from you and from our esteemed speakers, these efforts must be complemented from the top. We need to have genuine urgency, advocacy, and effective support from our leaders, our politicians, in order to facilitate and lead the implementation of evidence-based interventions and campaigns to address AMR. But as I look around this room and see so many leaders and such a commitment, I'm really optimistic that, in fact, together we can effectively address the challenge that AMR poses in each and every one of our countries. Thank you.
Thank you so much, Professor Borch. And if we can now scale up a bit from the individual professionals to the Commonwealth. We are, in fact, in a Commonwealth side event today. So if I can ask the UK Commonwealth envoy, Ms. Jo Lomas, to intervene now. I know there is something called the Fleming Fund, which the UK uses to bring evidence and people together when tackling AMR, especially in low and middle income countries. So my question to you is, how do you think this Commonwealth community, which spans the whole world, if you like, how do you think we can use these two tools of data and our professional people to continue in our fight against AMR? Ms. Lomas.
Great. Thank you very much, Chair. And before I get into the substance, can I just thank the Global Leaders Group and the governments of Malta and Rwanda for convening this important event today. We're going to talk a lot this week about recovery from the COVID pandemic, but it really is vital, as we've heard here, that we address the often silent and growing pandemic of antimicrobial resistance. When the first multilateral global action plan on AMR was agreed at WHO in 2015, it recognised that tackling this issue was not just about governments, but an endeavour that required a genuinely global and multi-sectoral approach, working with civil society, professional bodies on animal and human health bodies, those in science and academia, the private sector and philanthropy. In that global action plan, all our countries agreed to develop national action plans to make that a reality. On AMR, like many public health and other policy challenges, we need much better quality data to inform effective policy making. So the UK is investing some of our Fleming Fund, which is a UK aid programme, to support the GRAM project. This is looking at the global burden of bacterial AMR and helping to build the evidence base for action. In the GRAM report, data estimates that in 2019, there were over 1.2 million deaths globally per year directly attributable to AMR, making bacterial AMR the 12th leading cause of death globally. That's ahead of HIV, tuberculosis, and malaria. The data demonstrates that AMR is a burden for all countries across the Commonwealth, but it's disproportionate in some regions, for example, in sub-Saharan Africa. So, turning to the partnerships part of your question, Chair, we've also been using the Fleming Fund to deliver the Commonwealth Partnership for Antimicrobial Stewardship Programme, for a mouthful, which is working in a number of low and middle income countries in the Commonwealth. It's strengthening the capacity of the national health workforce and institutions to address AMR challenges. And so through mutual cooperation, these programmes are helping to build stronger, more resilient and integrated healthcare systems. And finally, we're working in partnership with the private sector too, through a £100 million collaboration with Unilever on hand washing. This has reached over 1.2 billion people in 37 countries, including 18 from the Commonwealth. And since 2016, the UK has also funded the Access to Medicine Foundation AMR benchmark, which uses data to push for responsible and sustainable antimicrobial production and distribution. I hope this gives you a flavour of what we're doing around data and partnerships. Chair, Marakosa Chani.
Thank you so much. Thank you so much, Ms. Lomas. And thank you once more, not only for your words today, but also for doing something concrete for AMR, because we hear a lot of words, which is important. Advocacy is important, and please do tweet and do use social media to promote this event and to promote the outcome of this event, because this is what it's all about. So hashtag AMR or at GLG AMR and hashtag CHOGM 2022. Please do tweet and do put it on social media, because we need this to come up on our international agendas. But at the end of the day, it needs to come down to concrete action, concrete political action, and concrete action like Ms. Lomas has just very, very succinctly presented to us. Now, yes, of course, AMR is a One Health. Needs a One Health solution from agriculture, environment, human health. It's a whole of society, as has been said, the situation. It's a whole of Commonwealth, because we're here today, but it's also doesn't look at ages. So it's not a question of elderly people who need hospital care or workers in the economy, but it's across all of our age groups. And we're pleased today and honored to have part of the leadership of the Commonwealth Youth Health Network with us here today. And I will ask Chair Ms. Lucy Fagan and Coordinator Dr. Ellen Peppera to give us the thoughts on how youth, how the younger generations, I'm quite youngish myself, so how our young generation looks at the challenge of AMR, and then finally what the Youth Forum, the Commonwealth Youth Health Forum is doing specifically to address these issues. So Ms. Fagan and Dr. Peppera, the microphone is yours.
Thank you so much, Chair. I'd love to share our experiences from the Commonwealth Youth Health Network and talk a little bit about what we're doing with young people to mobilise on AMR. During the last year, we've been mobilising young people across 54 Commonwealth countries on discussions around AMR, not only young healthcare professionals, but also diverse youth, students, journalists, patient activists, and community practitioners. We've worked with our partners across the Commonwealth, such as health professions associations, to increase young people's understanding of AMR, empower them to share knowledge not only with their peers, with other young people, but also with their community, with their parents, with their colleagues. And some people might ask why involve young people, and I think throughout this morning we've really heard why. This is a crisis and we all need to come together to address it. I see this as a generational catastrophe. If anyone is to worry, then it should be young people. We talk about AMR not being about age, but actually in a future without effective antibiotics, it's this generation of young people and the next who will carry much of the burden. Engagement is not enough. To actively address AMR, we need effective intergenerational partnerships that really bring together young people with other actors to mobilise on this, much as we've seen with other crises like the climate change crisis. And I'm going to pass over to my colleague Ellen, who's going to tell you a little bit about what we commit to this morning to address AMR.
Thank you very much, Lucy. So, just as Lucy said, it's very important that young people like us are engaged in the fight for AMR, and it's very important that awareness is created about what it means to have a world without antibiotics, what it means to have rational use of antibiotics, and what it means to be able to have proper antimicrobial stewardship. And so we as a network are very happy to announce that we are going to start a working group on antimicrobial resistance with an aim to create awareness around rational use of antibiotics and also to help young people understand the scope of the issue of antimicrobial resistance. We're also going to use this working group to hold all of our leaders accountable to the commitments you're making here today, so that in the future we can have a brighter future of having antibiotics available to treat our diseases in future. And also we'll be engaging in research to understand how it affects young people and how we can provide actionable recommendations to solve the issue and prevent antimicrobial resistance. And so yes, we call on all of you to support us in this endeavor. We are very happy that you are interested in this issue, and we are wholly supportive of this, and we look forward to working with you about this issue. Thank you very much.
Excellent, excellent. Thank you so much, and thank you so much for committing on this. And yes, the GLG, the Global Leaders Group, will be pursuing you to make sure that you do that, and for us to work together. So now I will ask our final speaker for this morning, the Minister of Health of Malawi, the Honorable Chiponda, to give us her thoughts on this global crisis. And we are just on time. So Minister, we can have the mic. You have the mic on your table. The floor for the next few minutes is yours.
Thank you so much. Thank you so much, our moderator this morning, Your Excellencies, Honorable Ministers, and the organizers. Malawi is happy to be part of this very, very important meeting this morning, talking about antimicrobial resistance and what is it that as countries we can do. As Malawi, we have our own AMR strategy, and which basically has 5 strategic areas. The first one being education and awareness, recognizing the importance of us engaging our people, engaging our citizens. And the second area is about surveillance and research. It is very, very important that we have laboratories in our countries who are capable of doing the job. So we need deliberate policies. We need a lot of investment in our laboratories, in our countries, and also to invest a lot in research for us to win this fight in AMR. And the third one is infection prevention and control. And of course, this involves our doctors, our clinicians, our nurses as well, especially recognizing that in most of our rural areas, we do not have even a medical doctor. We use our nurses. So we need a lot of capacity building and also investment in infection prevention and indeed in control. And the last one is investment and sustainability. We might have very good plans on paper, but we need funding to invest a lot, and we need sustainability, because it is only sustainability which will make a difference in this fight in MR. As a conclusion, Malawi is one of the few countries in the African region with a dedicated, albeit small, national budget, but we are dedicated to address AMR. However, like I've said, I'm happy that here we have our WHO DG, we have other members from other organizations. We need your support in our countries in order for us to achieve what we want to achieve in this fight in AMR. Lastly, thank you so much for giving me the floor. Thank you, sir.
Thank you, Minister Chiponda. Thank you so much. And that's, I'm afraid we're right on time, just out of time, so very little time for interventions, unless there's one really burning intervention or one really burning question, but so that's over now. I've done that. But so thank you very much, Prime Minister, Ministers, Director General, and my last appeal to you is don't just walk out of this door and forget about this. This is one of the bigger challenges of our and of the next generation. Not just for health, but for all of our society. So please do take action on this. Do go back to your departments, do go back to your ministries, do go back to your governments, and make sure that AMR is on the political agenda. We need to act now. So once more, thank you very much. Can I ask all of the leaders and speakers for us to have a family photo before we leave to keep this as a memento. So thank you very much, and thank you for being here this morning. Good day.